where I went to work was in Eau Claire, Wisconsin. Practically a good profession to get into, so. And what my job was to test these women about every 2 months and take their blood and see if they they wear masks and gloves, and but sometimes they aren't. There's the powder from making powder and filling them into 50 caliber bullets, and they absorb that in the system where it would affect their blood. And so I had to learn how to use the microscope and all that stuff. So while I was there, they were talking about having such a shortage of nurses after we went into the war. This is World War II. And so I decided to go, that we were going to be drafted, so I applied, and I didn't want to go to the Marines or the Army. I went into the Navy. And so I got my special training, as you do when you go into the military. And I ended up at the Great Lakes in Wisconsin, and then to Corpus Christi, Texas.
What age were you whenever you joined? What was your opinion of the war?
Opinion was pretty much against the Germans. Well, that lab work that I did in the civilian life is what got me when I got in the Navy, and they saw that I had some experience in lab work. That's when they immediately put me on a surgical ward. But along with that, I had to teach my corpsmen or the rest of some of the other wards when they got orders to come in, and so they learned how to take
Blood. Yeah.
I joined the military because I was interested in working in an industrial plant where they were making bullets, and everybody was getting prepared for the war.
What was it like to be a nurse?
It's very rewarding. It was a lot of hard work. I can tell you one thing. I was in surgery and was called in. I was on call, and I was called in because of an accident. And I walked in, and I saw this leg sitting in the corner. And I looked, and the man had a false leg, that burned terribly, and they called in all the nurses into the surgery, and my job was to hold this man's arm up because it was just all flesh bothered me. I was the only basis I was as a nurse. Wherever I went, where my husband was at, they always had a hospital of some type, from small to big, and so that I usually worked in all the different facets. My last job was out of Travis Air Force Base, something I did. And then I volunteered a lot. I volunteered, and whenever he was gone somewhere, I ended up in the hospital working somewhere. Especially when my children were old enough and got into schools. So it kept me active.
So were your bases ever attacked or anything, or?
No. I didn't ever go over. The only place I went overseas was after the war, was in Europe. We got over there there was some, but nothing like it was during.
Were you ever afraid of the war?
Was I afraid of the war?
Yeah.
No, because I wasn't in it in actual battle. It was being a pilot had that advantage. They were above it. They didn't see the actual combat, So I wasn't in that. I was in the hospital.